Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation covers lead and its health effects in children. Lead is a naturally occurring bluish-gray metal found in the ground. It has been used for hundreds of years for various products due to the abundant supply and how easy it is to work with. It is, however, a highly toxic poison which causes health problems. The use of lead in items is not visible to the naked eye. Lead is found in many areas throughout the environment. It may be in paint from old or some imported toys, art supplies, in many houses built before 1978, household dust, which may be brought in from the outside, or created by chipping paint or from areas of friction, such as opening and closing painted wooden windows, soil contaminated near roadways from previous leaded gas in factories, or from the soil near the house from peeling paint. It may be emitted in the air from industrial sources and travel before settling into the ground. It may be in leaded pipes, which can then enter the drinking water. Even lead-free plumbing may contain small amounts of lead. Leaded items, such as lead crystal, lead-glazed pottery, some jewelry, and leaded bullets. Some traditional ethnic home remedies or cosmetics, such as Azarkan or Kohl eyeliner. Some imported candies from Mexico. Some plastics, and gasoline outside the United States and Canada. Children may be exposed to lead through ingestion or by breathing in particles. This can happen by putting lead-contaminated objects or contaminated hands in their mouths, eating lead-based paint chips, playing in lead-contaminated soil, or eating food grown in lead-contaminated soil. Children may also be exposed through adult occupations or hobbies, such as mining, ironwork or welding, construction, renovation or remodeling, smelters, working with car batteries, lead bullet manufacturing, car radiator repair, or working with pottery or stained glass. There is no safe level of lead in the body. It usually builds slowly over time in the body as it attaches to calcium in the bones. It then causes serious health problems. Toxicity is rare after single exposure. Someone may not have any symptoms until the actual lead levels increase. Once present, symptoms may include a headache, stomach ache, nausea, irritability, aggressive behavior, constipation, fatigue and sleep problems, loss of developmental skills, loss of appetite, weight loss, high blood pressure, extremity numbness, memory loss, anemia, and eating non-food items. This may lead to behavioral issues, learning disabilities, delayed growth in puberty, cardiovascular problems, fertility issues, kidney or brain damage, seizures, coma, death, and then in pregnant women, reduced fetal growth, miscarriage, or prematurity. Here is a list of screening questions to see if a child is at risk for lead exposure. Does your child live in or visit a house or child care center built before 1978? Does your child have a sibling or playmate who has an elevated blood lead level? Is your child enrolled in Hoosier HealthWise or Medicaid? Does your child frequently come in contact with a person who works or has a hobby in a high-risk industry, such as a battery factory, smelter, stained glass, fishing, or reloading ammunition? Is your child a recent immigrant from a country where the use of lead in consumer products or traditional remedies, such as Azarkan or Greta, is not restricted? Have you exposed your child to cosmetics containing coal? If any of these answers are yes, then it is recommended that the child be tested for lead. Current recommendations show that children should be tested at ages 1 and 2 based on risk factors or as required by Medicaid. They may also be tested between ages 3 to 6 if they have never been tested and they live in or regularly visit a home built before 1950, if they live in or regularly visit a home built before 1978, if it is recently or currently undergoing renovations, they have a sibling or playmate currently or previously diagnosed with lead poisoning, or if they are on Medicaid. Pregnant women should be tested if they have risk factors, as lead exposure can harm developing babies. You should consider testing foreign-born immigrants and adopted children, as there are different regulations in other countries. Blood tests may be done to measure the amount of lead in the blood, known as the blood lead level, or BLL. This may be done from a capillary stick through the finger or heel, or from a venous blood draw. This detects current exposure or a previous lead exposure stored in the body. This is a medical and case management chart from the Indiana State Department of Health Lead and Healthy Homes Division. If there is a lead exposure, you should first locate and remove the source of lead. Education is initiated after a single capillary or venous level at or greater than 5 micrograms per deciliter. This is known as an elevated blood lead level, or EBLL. Environmental assessment and case management is initiated with confirmed levels at or greater than 10 micrograms per deciliter. This may be confirmed through a single venous blood draw or 2 capillary tests within 12 weeks of each other. Medical treatment is initiated with levels at or greater than 45 micrograms per deciliter. Chelation therapy is done to bind to lead so that it is excreted from the body in urine. Recovery takes time for levels to decrease, and they may never reach zero. Damage cannot be reversed once it is done. Be sure to continue follow-up care and retesting as indicated. Lead poisoning is 100% preventable through eliminating the lead exposure. You may do this by removing the source or by blocking access. If a home was built before 1978, have the home and soil tested for lead hazards. You may also test the water if the pipes are leaded. If there are lead hazards, cover bare soil with mulch, rocks, or grass, especially within 3 feet from the house, as lead paint may flake or run off. Keep kids from playing in bare soil areas. Damp clean flat surfaces, including windowsills, using a disposable paper towel. Damp mop weekly. Vacuum carpets and upholstery to remove the dust. It is best to use a HEPA filter vacuum or higher efficiency collection bag. Pick up and discard loose paint chips, using a disposable paper towel, then damp cleaning the area. Flush pipes and use cold tap water for drinking and cooking, as hot water can cause lead to leach from the pipes. Use proper precautions to contain lead hazards when making changes, improvements, or maintaining the home, such as not sanding or scraping lead paint. Make sure children and pregnant women are not present during any renovations. Keep the home maintained. Lead may be under layers of paint or other areas, but can be contained as long as it is in good shape. Fix any issues of deterioration. Have EPA certified professionals cover or remove lead hazards. For the family, frequently wash hands and toys, especially after playing outside. Remove shoes before entering the home. Avoid using lead-containing home remedies or cosmetics, such as Pelua, Dotway, Sindor, or Kohl. If used, seek immediate medical attention. You may also contact the Indiana Poison Control Center at 800-222-1222. Use caution with imported candies or tableware. Use caution with food storage. Do not store food in imported pottery or dishware, as it may contain lead. Do not store it in leaded crystal. Remaining canned food should not be stored in the cans. Monitor for lead-containing recalled items and remove them from the home. You can always check the Consumer Product Safety Commission website at www.cpsc.gov/recalls. If a household member works in a lead-related occupation, make sure they shower, change work clothes and shoes before entering the vehicle and the home. Wash work clothes separately and keep these materials away from the living space. Have the child's blood lead level tested, and be sure to eat nutritious foods, such as low in fat, high in calcium, high in vitamin C, and high in iron to reduce lead absorption. This concludes the lead and its health effects in children presentation. If you have any questions or concerns, you may contact your local health department or follow up with your physician. Thank you.